Hi everyone, this is Dr. Tae, and these are my results that are in from the 72-hour fast. Before I start getting into all the information, one, do not try this at home by yourself. Talk to your healthcare provider first before you start to do this. Do a lot of research, and I do not want anybody watching this video attempting to do this by themselves. Um, I started fasting many years ago, more than 7 years ago now, and I'm able to do a 72-hour fast whenever I feel like it. However, if you're doing this for the first time, I recommend that you slowly ease into it. Step one, start skipping breakfast. Two, learn how to eat like a simple fruit for lunch and then eat dinner. And if you're able to maintain that for 2 weeks at a time, your body will adjust. And then if you do that for at least 3 to 4 months, then I would recommend that you start making the attempt to do this. Um, and if you're interested in doing more intermittent fasting, the way I guide people, um, it's not good for weight loss. There is weight loss expectation, but there are other health benefits that I want to get into. In my previous video, I talked about the importance of autophagy, that your immune system goes around making dropping biomarkers on irregular cells, and once the biomarker is set, your white blood cells, macrophages come onto the site, and they get rid of those red blood cells, liver cells, or any type of cells that has error or mutations, and they process it to remake it. And once that takes place, um, it shows that it resets your immune system, and there's a lot of other health benefits. Now, in a people who are diabetic and joining the intermittent fasting movement, they always come back and say, hey, my insulin levels, even though I'm not eating, is going up. Why is that the case? If you read Dr. Jason Fung's book, it talks about this. It is normal for your insulin levels to rise. So you could check out his book to learn more about this phenomenon. But this is why you need to make sure that your doctor has patients who does intermittent fasting, or they do intermittent fasting themselves, not just read it on Google and stuff like that. I think you want to talk to a person that is a healthcare provider who has tried a lot of intermittent fasting over the years, so that you get the best advice that comes from experience, not from some articles that you just read about. Okay, now I'm going to turn your attention to the screen right here. Okay, now let's talk about a day that was not here. Okay, I started this on, what is that, March 18th, starting on Monday, highlighted right here. Now, I normally weigh about 185 pounds, but leading up to this day was my in-laws were visiting from Canada for about 2 weeks for my birthday week, and my mother-in-law was cooking up a storm every single night. And I would come home, I'm like, she's got all this like goodies made, and she made it from the bottom of my heart, from her heart, and I couldn't say no. Plus, being my birthday week, I think I had one chocolate shortcake. Thanks, Courtney, for not buying me chocolate. However, she got me some chocolate bars, and there were a lot of chocolate cakes that I've had. So, what would normally be my ideal weight for my physique was around 185 pounds. And then I jumped up to 194. I gained literally 9 pounds as they came. So by the time they left, I was feeling like horrible. I knew I would gain weight, my clothes fit differently. And that morning, when I came to the office, I had already gone to the bathroom at my house. So by the time I got onto the scale, I weighed 194. If I had the food in me as poop, I would have weighed close to 194 pounds. I mean, more than 194. I knew I weighed at least 197 with all that food inside of me. At that time, my body mass index was at 29.5. 30 is considered obesity. And my fat percentage was at 37.2. My fat-free mass, anything that is not considered to be um, fat, is 121. Your muscle mass is 115.6. And based on your total weight, taking off your fat percentage, your water mass, bone mass, leaves you with your poop mass, which I really don't go into. And that's how you're able to figure out how much poop is inside of you. Sometimes I got to do those numbers for specific patients because some people feel like they're not completely going to empty themselves out. So that's where it is. Okay, so now as the day one was easy because it was just one day, and when I woke up next day, I lost more than 6 pounds, close to 6 pounds. Right, my BMI dropped significantly to 25.6. My body fat percentage went from 37.2 to 25.6, and my muscle mass, if you look here, jumped up to from 115.6 to 133.4. Now, why does this happen? Because I was drinking a ton of water. I was drinking water every time I felt hungry, and those water had sea salt, magnesium, a little bit of zinc, um, and I was drinking a lot of tea just to constantly hydrate myself. So it's not that I was gaining muscles; it's just that my muscles were better hydrated, and my bone mass finally. Your bone mass always stays at a certain level. If you look here, it was at 6.2 on Monday, but it stabilized at 7. So 7 is the actual consistent number. When your body is really acidic, like eating a lot of what I consider crap, a lot of oily foods, fried foods, it will go down just a little bit, but bounce back up once you stabilize yourself. And you can see that over here. My basal metabolic rate was at 6,900, 7,800, 7,300, and 7,700. My metabolic age went from 59 to 55 to 48 back to 54. My visceral fat rating, I was 1 point away from becoming pre-diabetic. There is this graph where it's a thin red line, um, and 17 would have been like I would have said, okay, I'm gaining so much fat around my organs that it's going to impede in my pancreatic functions. So one thing I'm glad, it jumped right back down to 11, 10, 11, and I usually stay around 11 or 10 or 9. According to this, my ideal body weight is 144.6 pounds, and my degree of obesity went from 34.2 to 30.4 to 29, and on Saturday, just today, what I measured is 28.5. So, what this shows, I don't want people to do intermittent fasting for weight loss. There is a weight loss component, and there is a proper way to go about doing it. And I think one of the main benefits of me doing a 3 day fast and showing people, hey, this is what happens, is that Monday, fine. Tuesday, I started feeling good until 5 o'clock, and after 5 o'clock, I started feeling horrible. And on Wednesday, when I came to work, I was very withdrawn. I didn't feel like moving. I had to really motivate myself to take care of my patients, and uh, it's not easy to do this, especially if you're very active like I do. Thursday, I broke the fast on Wednesday night. Thursday, I ate only one meal. Um, Friday, I went out with my buddy and we went to Fogo de Chao, and we ate tons of meat. And I was full for all day. And this morning, I haven't eaten anything, and I'm at 185.8. Most likely, because the level of fitness and activity that I do is going to continue at 185 pounds. But once I get back into a more active lifestyle, I've seen my numbers drop from 185. When I'm doing a fast from 185, it drops down to like 180, 175. And if I maintain a good body weight, my numbers go back to 170. So this is like how a lot of people have the yo-yo body weight. You can do something like this at your worst. You could do this at your baseline. And from your baseline, you push it down further. And this helps me gauge how I maintain my body weight in a healthy way. So, if you have any questions, write in the comments below. And if you'd like to see more contents like this, hit the like button, um, and stay tuned for more videos. Thank you. Bye. And just to show you that the records, I did use a Tanita scale. And these Tanita scales, like the receipts, I don't know how much you can see it. It shows you my numbers, which is reflecting on the, um, what is that? On the Excel spreadsheet. Okay, so I'm not making these numbers up. They're actually based on um, the measurements from the Tanita scale. All right, thank you very much and have a nice day. Bye.